I had a really good turnout for this talk on weight loss resistance. We had some technical difficulties, so this is actually a record. So let's get busy. I'm Cherise Branch. I've been a nurse practitioner since 1999. My background's internal medicine. I'm double board certified as in family practice as well as in geriatrics, and I've had my own functional medicine practice since 2016. Why am I qualified to give this master class? Is it because of all those fancy letters after my name? No, not really. More importantly, it's because I have been there. I have a history of disordered eating in my teens and my 20s, enough to where all that caloric restriction has me on a thyroid prescription. I went through numerous in vitro fertilization attempts to have my gorgeous 11-year-old. So I hit perimenopause in my 40s with an absolute bang. So I have navigated this very challenging period with crushing fatigue and weight loss resistance. I feel blessed I can share with you my personal and professional experience and hopefully save you years of misery. I didn't fully grasp how the ebbs and flows of my hormones affected my moods, my productivity level, and my weight. So I didn't know how to match my lifestyle to how I was feeling and to those ebbs and flows and save myself some misery. So let's go over some tips. As a practitioner 30 years ago, I was very wrong saying less, exercise more. Calories in, calories out is not our solution for weight loss resistance. So we know that in the past few decades, chronic conditions like Alzheimer's, cancer, diabetes, infertility, cardiovascular disease, autoimmunity, chronic pain, all of those have skyrocketed, unfortunately. Cardiovascular disease, let this sink in. It's the #1 killer of we women here in the United States, causing 1 out of every 3.2 deaths among women annually. Your inability to lose weight ties directly into the increased amount of disease that I just mentioned. So there you have it. There's no doubt you've heard about semaglutide or tirzepatide. If I save one person from getting testosterone pellets, thinking a bucket of testosterone, or just getting on semaglutide or tirzepatide injections and all their weight problems are solved, if I just save one of you guys from jumping on that bandwagon without getting a comprehensive approach, then this talk tonight has been a definite success. So let's go over some definitions. Menopause, 1 year without a period. If you have spotting on your 11th month without a period, you are not menopausal. Perimenopausal is the transition phase into menopause. It typically can last 5 years, 8 years, maybe even 12 years. It's hormonal ebbs and flows where your hormones no longer follow a nice, neat pattern. Progesterone is the first hormone that we ladies lose of our 3 sex hormones, estrogen, progesterone, and testosterone. Often I see estrogen dominance where women lose their progesterone. They can't sleep. They're anxious. Their periods are like a murder scene. They end up with an endometrial ablation or a hysterectomy. What is concerning is I see women entering perimenopause earlier and earlier, age 35, 38, not an age where you think that we would be challenged with feeling fat, fatigued, forgetful, having weight loss resistance, and feeling that our body has deserted us. Crushing fatigue and weight loss resistance is by far my 2 most prominent concerns I get from ladies. According to Sarah Gottfried, 99% of weight loss resistance is hormonally mediated. 99%. Give yourself a big hug. This is something that we're going to talk a lot about. So cut yourself some slack and recognize that we healthcare providers have been giving you the wrong advice for the last 30 years with eat less, exercise more. We like to blame you for not being able to lose weight because we really haven't been able to provide you with any good solutions. Hormones at play are the base, the root cause in weight loss resistance. So again, CICO, calories in, calories out. I want everyone to know that our bodies are much more complex and sophisticated than just that simple equation. I follow Dr. Jason Fung, Cynthia Thurlow, some of the thought leaders today on metabolic health, and it is about understanding insulin and cortisol and how those 2 hormones are critical. Each of us has a unique physiology. And as we get older, 35, 40, we start going through something that you may refer to as reverse puberty. Again, that's perimenopause. Estrogen is generally in a sawtooth pattern, real high, real low. There's not enough progesterone to balance the estrogen. So a conversation about weight loss resistance would go nowhere if we did not define these 2 stages. First, There are many of you out there that probably have an IUD. I've had chat messages about this. You've had an endometrial ablation. You don't know exactly where you fall on the spectrum. Am I menopausal or not? I don't have my periods anymore, but what does that really mean? Yes, there's workup that we can utilize to ferret that out. You want to check a blood level, an FSH, follicle stimulating hormone, an LH, a luteinizing hormone. Perhaps you want to check the lady's salivary hormones and see how much estrogen, progesterone, testosterone are their ovaries producing. Are their adrenals pitching in with the job? Just know it's a slippery slope here in these stages, especially perimenopause. I hear a lot about brain fog, sleep disruption, just a generalized life decline. So before I hit statistics, again, give yourself a hug, honor yourself. You've watched your friends succeed at a popular diet. How come you didn't get the same results they did when you mimicked exactly what they did? It is frustrating to go to we healthcare provider's office only to hear the same thing. You're not exercising enough. You're obviously eating too much. This is all of your fault. Let go of that now. The average weight gain that we see ladies suffer with in perimenopause, menopause, it's 5 pounds from perimenopause, but more than 20% of us are going to gain 10 pounds or more. I frequently see 25 pounds as the magical number with my menopausal patients, my newly menopausal patients. So there's a lot of physiologic change that is going on in our bodies. There was a UCLA study that demonstrated that during menopause, we lose lean muscle. What a surprise. And we more than double our body fat mass. How many of you have been frustrated with the abdominal pooch, the cortisol pooch, the menopausal belly roll? Is it any wonder that this time in our lives, when we start struggling with weight loss resistance and notice that our bodies are changing, my body's been rearranged, my body's deserted me, I'm going to the gym more than I ever have before, and I still am flabby. Just know that in the first 2 years of menopause, the rate of fat gain doubles and lean muscle mass declines. That may not sound like a lot, but cumulatively, when we're losing muscle mass and gaining adipose or fat tissue, do know that fat tissue is a metabolically active tissue. It's not just fat, it's highly inflammatory, it's full of cytokines, it's a dense tissue, it has a lot of signaling molecules that can drive satiety or feeling full after we eat, as well as hunger, as well as cravings. The incidence of being overweight or obese, if you are a female, age 40 to 65 in the United States, is actually 65%. If you are older than the age of 65 years old, you have a 75% chance of being either overweight or obese. And you can see some of those citations in blue on that slide. So why we're not able to lose weight? There's a big misconception. There's one thing, calories in, calories out. That is incorrect. Every square seen on this slide impacts our hormones. The problem is that people, when they think of hormones, they just think of estrogen, progesterone, and testosterone. But in reality, hormones aren't just those three. They're also our thyroid hormone or cortisol fight or flight hormone. Vitamin D3 is a prohormone, insulin, cortisol, again, ghrelin, and leptin. So these 9 squares mentioned, each one of these are going to be broken down on the slides tonight and talked about in terms of weight loss resistance. Muscle loss, that's a fancy way of saying sarcopenia if you're in the medical community. Muscle mass loss is not a question of if, it is a question of when. It does not start occurring at 50. It actually starts beginning around the age of 35. Poor quality sleep, that goes without saying. Stress, that really goes without saying too, about everything that we've been through in the last 3 years or so with politics, pandemic, the economy. You've heard of gaining the COVID-19. In reality, the amount gained was generally around 25 to 35 pounds. A lot of people turn to alcohol for coping with feeling so isolated. There was a UNC Chapel Hill School of Public Health study done in 2018. At that time, 88% of us Americans were metabolically unhealthy. Think pre-diabetic, diabetic, inflamed, overweight, stroke, hypertension, heart attack. That number now is about 93%. So we went from 88 to 93 a mere 5 years later. And obviously the pandemic had a lot to do with that. Imbalanced macros, it's like my favorite topic. What am I talking about? Your macronutrients, protein, carbs, and healthy fats. How should we structure these? I'm going to add in alcohol because we're going to talk about that too. Hormonal fluctuations, again, it's more than just sex hormones. We're also going to talk about meal frequency. In 1969, when I was born, we had 3 meals a day. If you didn't like what was served at that meal, you just have to stay hungry until the next one was served, like it or lump it. Now, on average, we eat 6 to 10 times per day. We healthcare providers are in part to blame for that because, again, we were busy telling you to eat small snacks every 2 hours in order to stoke your metabolism. that was bad advice. Gut health, you knew we were going to talk about that today. It's well established that a short course of antibiotics like a Z-Pak can impact your gut microbiome, the bacterial, fungi, yeast community that we all have, for up to 6 months. There's a definite reduction in diversity in terms of strains or families of bacteria. There's compelling research suggesting that our gut microbiome can influence our ability to lose weight. In particular, there's a strain called Akkermansia that's getting a great look-see right about now. Toxins, EDCs, endocrine disrupting chemicals, those are things that we're exposed to in our environment, personal care products, drinking water out of plastic bottles, microwaving in Tupperware, nonstick cookware. There's also robust research on ACEs, adverse childhood events. We know loss, abuse, bullying. Individuals that have had a significant amount of ACEs, they are definitely at greater risk of autoimmune disease and definitely at a greater risk of weight loss resistance. So this isn't a comprehensive list. Scary enough to think of, right? It's all of these things, but I just want to give you a snapshot and let you come away tonight knowing it is not just calories in, calories out. Do know this is why you can't just jump on a semaglutide or a Mounjaro shot or a testosterone pellet. Do I prescribe testosterone? Do I prescribe some of those weight loss injectables? You betcha I do. But I would be remiss if I was not addressing all these other steps first. Here's our fancy word again, sarcopenia, muscle loss of aging. This occurs on a cellular level, not just superficial, how we look in our bikinis. There's actual changes in muscle fiber or myosin, which is one of the components of muscle, and the mitochondria, the cellular engines, the powerhouses of our cells. We can't run as fast. We cannot lift as heavy unless we are diligently working against this loss. This starts again in our mid-30s. Not in our 50s, as you may have previously believed. Sarcopenia occurs in the skinny fat people, but it also occurs in obese folks as well, unless you are actively working against this happening. And I talk to ladies on a daily basis about strength training, lifting heavy. If you have limited time and you can either get on the treadmill and jog 3 miles or lift some heavy things around the gym and hop out of there after 20 minutes, I'm going to tell you to choose the weightlifting every time. Oxidative stress negatively impacts how our muscles contract and then leads to atrophy, weakness, and fatigue. Remember, as thought leader Dr. Gabriel Lyons says, muscle is the organ of longevity. It helps with us remaining insulin sensitive. And when we start losing insulin sensitivity, the older we get, even if you're not diabetic or pre-diabetic, that means you're going to have more insulin floating around in order to get the job done of getting glucose into our cells from the bloodstream. More insulin floating around comes from less muscle mass. It comes from us being less insulin sensitive. It comes from our loss of estrogen. More insulin floating around equals a higher amount of fat storage hormone because that's what insulin is. And of course, that impairs our ability to lose weight. So these are the reasons why even my thin patients, say somebody that's 140 and their goal weight is 125 and they're saying, why can't I lose weight? I used to not have a problem with this. Well, you have less muscle, you're losing your estrogen, you're not lifting, you're not doing resistance training, and you're stressed, and cortisol drives your insulin up. So there you have it. Multifactorial. Exercise. I see a lot of women doing the wrong types of exercise, too intense. I am not suggesting do not exercise. But just don't get caught up in the trap that I did. Let me go jog my chronic cardio 3 miles a day on the treadmill. No intervals, no weight training, no mixing it up. I'm going to pick on CrossFit for a second. If you're doing CrossFit 5 to 6 days a week without adequate, proper recovery, that is definitely overtaxing to your body. We already are heading into a de facto less stress resistant state in perimenopause and menopause. It doesn't mean that you can't handle stress at all, but you better be more mindful and proactive with how you deal with stressors. So understanding that when you're doing super intense exercise without recovery, layered over an already stressful life stage and a stage where you're less stress resilient, your fight or flight hormone cortisol is being impacted. Cortisol is undeservedly demonized. We have to have it. Just know that if it's dysregulated, it leads to elevated glucose, again, leads to our friend insulin being elevated, and that's a fat storage hormone. Our body's autonomic nervous system, and I'll talk about this later as well, there's the parasympathetic arm and the sympathetic arm, the yin and the yang. Parasympathetic is rest and digest. Sympathetic is fight or flight. When our body is in a state of need, cortisol is dysregulated and the sympathetic nervous system is dominant. So we're living like we are the caveman being chased by the dinosaur at all times. We are not stopping to poop. We are not stopping to detoxify. We're not stopping to have sex or slowly eat a meal and chew adequately. All of these things impact weight loss resistance. If our body is chronically stressed and you are not plugged into that relaxation side of the autonomic nervous system, you're going to be skiing uphill. It is critical to choose the right types of exercise and not overtax your body. It's the females that come into my office that are running chronically 8 miles every day. They're calorie restricting. They never lift a weight. They don't laugh and have fellowship with other girls at the gym or a walking or a book club. And they're wondering why they're not able to lose weight. That is impacting, again, the autonomic nervous system, and fight or flight is playing a role. So remember in our late teens and our 20s when we thought, we don't need any sleep here. We prided ourselves on that. Just know only a fraction of our population, maybe 3 to 5%, can actually get away with less than 7 hours of sleep a night. When you sleep less than that, it increases cortisol, which again increases blood sugar, increases insulin. And our hunger and satiety hormones, ghrelin and leptin, are dysregulated. We do not crave kale and spinach when we are sleep deprived. Our bodies are craving a quick hit, usually in the form of a simple carbohydrate, a donut, a Coke from Dairy Treat. We're just looking for a quick, easy fuel source. So begins the vicious cycle, and then you crash and you're fatigued. Also consider your relationship with alcohol. Alcohol definitely erodes sleep quality. It suppresses melatonin, which is one of our key hormones that help us go to sleep and stay asleep. Is my alcohol or my sleep more important? Skewed hunger cues related to lack of sleep also equate to weight loss resistance. Sleep deprivation increases cortisol production, increases fat storage, decreases insulin sensitivity. This is not benign. Chronobiology, that's a fancy term, which basically is looking at our natural circadian rhythms. We have to honor those rhythms. It is no secret that people that work shift work, whether they're male or female, gain weight or at least struggle to maintain their weight, because we have a master circadian pacemaker that controls our timing of our sleep-wake cycle. So a lousy night of sleep, it has everything to do with the fact that your body's trying to digest food because we're eating later and later. It's busy doing that instead of secreting melatonin. Another example of chronobiology is when we get natural light exposure early in the morning. We let sunlight send a wake-up signal to the pituitary gland, and then the pituitary gland responds by releasing hormones. Bright morning light tells your body to suppress melatonin production and increase cortisol production. That's when it's good. We want it higher in the morning. It's our get up and go hormone. So we want to wear blue light blockers in the evening if you must have screen time, to assist with letting your body know that it's time to make melatonin. Anybody that's watching this evening, most of you guys are sympathetic dominant. We are in a constant caveman running away from the dinosaur mode. That means we have a continual internal to-do list on our brain. We girls, we think we have to be perfect. We're working full time. Our 3 kids are dressed perfectly. We're putting 3 square meals on the table, but we're also paying the grocery bill to put those meals on the table. We are not ever allowing our body to feel safe, rested, nurtured. Enough is enough. I've achieved enough. That is sympathetic dominance. My job is to teach women that understanding that stress management is critical, and it is more than 5 minutes of meditation once a week. You do not relax when you are working out. It may be fun if you do get a chance to go with your friends, but you're going to need to actively protect some time to get yourself to gear down in the evening, just like we did with our toddlers. We had a warm bath, we had a storybook, we had snuggles and tuck into bed and prayers, so that we need to set a routine like that as well, because we already know that cortisol dysregulation impacts insulin and fat storage. Also, if your insulin levels are high, you're not able to free up free fatty acids and utilize those as an energy source. That's another problem. How do you quiet self-doubt, uncomfortable feelings? I really like to follow a gal named Mel Robbins. She has audiobooks, workbooks. She's on Instagram. She often speaks about imagining if you gave the same love and encouragement to yourself as you do for others, being everybody else's cheerleader. So that really contemplate that and work on cutting yourself some slack. How do you manage and mitigate those feelings of discomfort? Do you overeat? Do you overexercise? really reflect on that question. Am I ever good enough? Imbalanced macros. Didn't learn about this till late in my journey as a healthcare practitioner. We don't get much on nutrition, but you guys knew that already. This is one of my favorites in terms of giving you women back power. For 30 years, again, we healthcare providers have been teaching everybody eat every 2 hours, stoke that metabolism. Then you come in, of course, you hadn't lost any weight, you gained weight, and then we demoralize you and tell you you're not exercising enough and you're lying to us because you're eating too much. As per Dr. Jason Fung, weight loss is hormonal. It is not calories in, calories out, and it has been very cruel that we have put the blame on you guys instead of putting it squarely back on us healthcare providers. We didn't counsel you correctly because we didn't know what to tell you. It is very classic of women that I see that they are chronically under eating clean sources of protein. They're deathly afraid of any and all fats. So what they do, it results in them eating too many carbs and doing what I call ringing the insulin bell. Because when you ring the insulin bell all throughout the day, you have higher levels of insulin floating around. Again, that's a fat storage hormone. But we can't demonize carbs either. Depending where you are at in your life stage, that is how we determine, or that is how we determine how many carbs you actually need. Women do need carbs for their estrobolome. That is our microbiome, our bacterial environment in our gut that actually is responsible for packaging up estrogen and shipping it on out of the body through the intestine and the bowels. So we do need some carbs. We need limited carbs, but we need healthy carbs. And again, I'm going to counsel a 35-year-old who may be trying to get pregnant. I need to be more liberal with her carbs the second half of her cycle, the luteal phase after she ovulates, compared to, say, a 65-year-old that she's not interested in reproducing, obviously. She is going to get a stricter carb food plan from me than, say, that 35-year-old. So the macros are very much dependent upon where you are at your life stage. Carbs need to come from non-starchy veggies, low glycemic fruits. So you need to be thinking berries, green apples, not white grapes, pineapple, and mango. Again, most women eat about 40 to 50 grams of protein daily. And what I tell them to strive for is their ideal body weight in protein. For example, I should eat 135 grams of protein every day. I tell ladies to shoot for that. That way I know I've coerced them into eating at least 100 grams of clean protein a day. Protein is necessary for satiety. Protein is necessary for us to maintain that muscle mass. We're not going to feel satiated if we do not reach our protein goals. What are the wrong kind of fats? I'm talking industrial seed oils. We call them the hateful eight. There is a Dr. Kate Shanahan who has done wonderful work, a physician researcher on industrial seed oils and how they negatively affect the metabolic health of each and every one of our 38 trillion cells. You see these all the time. They're in everything. Condiments, our protein bars. Just to list them for you, canola, the one that has the heart healthy sticker on the bottle, corn oil, cottonseed oil, soy, sunflower, safflower, grapeseed, rice bran. They damage your mitochondria. Those, again, are the motors in your cells. They proliferate into what we call the phospholipid bilayer of each cell, and they make that cell inflammatory. They change our cravings. Just remember, the food industry and big pharma is not about your health, and they are not beneath misleading you. It is all about making money. Restaurants fry their foods in these seed oils. It's in their salad dressings, their condiments. So you need to be an informed consumer and know that there is a direct relationship with the consumption of seed oils, direct relationship to insulin resistance, weight gain, and carbohydrate addiction. So you want to push the protein. You want to eat the right types of fat. I think avocados. Develop a good relationship with coconut oil, avocado oil, extra virgin olive oil, lard, beef tallow, butter, ghee. Those are all great choices, things that we have been morbidly afraid of for the last 30 years because we healthcare people told you the wrong thing. So you want to eat your food in the correct order. You want to eat your fat and protein first before you eat your carb in a meal. You have to reframe your thinking because what we did in the 20s does not serve us well in our 40s, 50s, and 60s. Again, the amount of carbs that you get depends on how insulin sensitive you are. So forgive me for throwing in this busy slide. I grew up in the lower middle class, which was actually pretty good because everyone was poor back in the 60s, 70s, and we got 3 meals a day, no snacks. That included at 4 o'clock, snatching an apple off the countertop. That was a no-no because an apple will ruin your dinner. Put it back. Nowadays, we have snacks everywhere we go. The big food industry is feeding us hyper palatable, highly processed carbohydrate dense foods which dysregulate our hormones. So here's a visual. I personally find the myplate.gov offensive because what's the change here? There's tons of grains on both of those. So our government sleeps with the big food industry. So meal frequency, snacking, when you eat, along with what you eat, inflammatory seed oils, gluten, dairy, alcohol, sugar, and soy. Those are the big ones. Remember, your insulin sensitivity dictates your carbohydrate threshold. It's a cheat on food labels when you look at net carbs. That is shady math, especially by the keto protein bar crowd. You want to look at total carbs. Forget about net carbs because they're trying to do, like I said, the sneaky math with throwing in these sugar alcohols and a little bit of fiber to mask how many carbs that food product actually contains. So I challenge you to go look at some protein bars and start looking at the grams of carbs that they contain. I am encouraging you now as adults, if there's anything you take away from this, you don't need to snack. It's just life, 2 to 3 meals a day. We don't need any more. Insulin's a storage hormone. It's meant for us to keep it low. Of course, ladies who are cycling, again, they get a different rule book. Just know our bodies are set up to thrive on feast or famine. That means eating needs to be in discrete, compartmentalized timeframes without snacking. So, Jason Fung, Canadian nephrologist, that's a kidney doctor. His work is in regards to weight gain as a response of cortisol and insulin. Too much food, too much inflammatory food, too frequent food, all contribute to insulin resistance. When you're insulin resistant, your body has higher floating levels of insulin all the time. In Cynthia Thurlow's work, she highlights that precisely. Insulin is so powerful that it takes 5 other hormones to counterbalance its effect, and you can see them listed here. Know that insulin resistance is the leading cause of death in our developed and developing world. You name any chronic disease like hypertension, heart disease, Alzheimer's, polycystic ovarian syndrome, cognitive issues, those are all related to insulin resistance. And my goal is to keep my patients, you and your loved ones, insulin sensitive. Anyone watching this needs to request for their primary care provider to order a fasting insulin level. $12 to $15. This is an inexpensive test. You need it drawn twice a year. Please, please, please request it. And so then there's hormones. It's all about the hormones. It's always about the hormones. I think it's important to understand that these hormones are bad in and of themselves. Insulin, we have to have it to live. Someone who's metabolically healthy, meaning a person who has good blood pressure, reasonable HDL, healthy cholesterol, low triglycerides, they don't have truncal obesity or fat around their waist, they have a healthy blood sugar. I like that between 75 and 90 when they wake up in the morning. Fasting blood sugar, insulin should be between 2 and 5. I like to use continuous glucose monitoring in my practice. It provides tremendous insight, even for those of us who are not pre-diabetic or diabetic, how ordering our foods or eating our foods in the wrong order, the macronutrients can really impact our blood sugar. I like triglycerides under 75. Our HDL fluffy cholesterol in women need to be above 55, above 45 for men. Women want a waist circumference less than 31.5 inches. And so those are just some of the objective markers of being metabolically healthy. 88% of us in America are metabolically unhealthy now. So what does that mean? That means when our hormone insulin is low, our body can use fat as a fuel source. So we can train our bodies to be metabolically efficient or flexible by practicing intermittent fasting. So I teach about intermittent fasting, extended fasting, therapeutic fasting on a daily basis, especially in my office hours. Again, ringing that insulin bell is something that we want to avoid doing. You got to eat your macros in the correct order. Fats and protein first, fiber first, carbs last. Every time. Know that insulin is mitigated by stress and poor sleep. It's mitigated by poor food choices, meal frequency, and the incorrect type of exercise. Cortisol works in conjunction with insulin. When your cortisol is properly balanced, you got a much better chance of your insulin being balanced as well. But if you're chronically stressed, your cortisol levels are up, blood sugar up, insulin up, fat storage up. Leptin and ghrelin, 2 satiety and hunger hormones. They are signaling hormones that tell us when we are full. If they're properly regulated when we get enough sleep, when we manage our stressors. We also know that obese patients are often leptin resistant. That is why they always feel hungry. They have a disruption between leptin signaling between their brain and their stomach. Then there's estrogen. There's 3 types of estrogen: estrone, estradiol. As we're heading into perimenopause, we have got fluctuating amounts of estrogen without the proper amount of progesterone to balance it. Low estrogen can impact food cravings tremendously. So managing estrogen levels can actually assist with cravings and insulin sensitivity because estrogen is insulin sensitizing. So remember, if you're losing estrogen, you are likely becoming insulin resistant. So in my one-on-one consultation and in office hours, we do talk a lot about hormones, hormone replacement therapy, whether or not it is an important thing for you to consider. Again, you measure those hormones and you test and you don't guess. Crucially, there is saliva testing that accurately measures the hormones that are bioavailable to our organs and tissues to be used. And then there is urinary testing that checks metabolites. It checks how we women metabolize or process our estrogen and rid our bodies of estrogen. Is it being packaged up and getting removed from the body through a bowel movement, or is it recirculating? That is when we get into trouble for breast cancer risk. And a term you may have also heard with that is estrogen dominance. Comprehensive blood testing is super important. Women are not getting their thyroids properly assessed. I look at 6 different parameters. You got to look at a free T3, free T4, your thyroid antibodies, reverse T3. If your thyroid's off, that impacts your mitochondria, those motors that are within our 38 trillion cells. They impact energy production and how well our sex hormones look. So how can we expect to be metabolically healthy if we don't have our thyroid running like a V8 engine and not like a V4 engine? Think of it as a thermostat for the body. And low thyroid is frequently discovered in my practice. Testosterone, critically important for women. If someone is low in testosterone, if someone is slightly low in testosterone, I write many a testosterone prescription. We do not need much, but it is important. It does not impact just libido. Yes, it helps us with our sex drive, helps us with lubrication of the vaginal tissues, but it is very important for maintaining muscle mass, brain signaling. It is like Goldilocks and the 3 bears. You need just the right amount, not too much, not too little. Hormone pelleting and the supraphysiologic levels that go along with pelleting, that is too much. It is a professional mission of mine to educate ladies about the very harmful side effects by those super high testosterone levels that those pellets dose with. They're too high in over probably 95% of the time. I see many a woman that has come to me post-pellet. They have spent a lot of money. Their hair is thin. They've gained 15 pounds around their midsection, and their lipid profile, their cholesterol parameters are skewed. That is from super duper high doses of testosterone. Again, when a patient needs testosterone, I'm the first person to write the prescription. Too much is just as harmful as not enough. We have estrogen, testosterone, and progesterone receptors in every area of the body, our bone, our brain, our colon, our joints. So it is absolutely critical to get the balance right. It's a very important part of navigating middle age. And I see younger and younger women with imbalanced sex and thyroid hormones. Again, that ties into the role of the HPA axis. As you see there, the hypothalamus, pituitary, and the adrenal axis. That's a big fancy way of saying that the brain controls all of these hormones. It also controls the glands that secrete them and how the receptor sites that accept them, how they behave. Your brain is impacted by chronic stress, no surprise. So it makes definite sense that I am seeing these imbalances at a younger and younger age in our stressed out society. Our society that has fluorescent lights on all the time, computers glaring, lights glaring, and nobody's sleeping enough and mitigating their stress. So again, being less stress resilient at middle age keeps our brain and then subsequently downstream, our body as a whole potentially more inflamed. And you knew that I was going to talk about gut health. We couldn't leave without that. Your own microbiome may also impact the production of your hunger hormones like ghrelin and leptin and neuropeptide Y, which controls how hungry or full that you feel. An unhealthy gut microbiome can increase inflammatory markers, which of course will lead to weight gain and metabolic disease. Often when people are weight loss resistant, it is related to undiscovered infections in their gut. That's why we functional medicine providers don't ever forget the gut. And we like to go poking around and seeing what your microbiome looks like. We do that with the stool test. Our microbiome impacts the amount of calories that we extract from our food. For example, the Firmicutes strain breaks down carbohydrates by fermentation. Butyrate is a byproduct. There's some compelling research on a family of bacteria, a phylum called Akkermansia. So obviously, this whole thing should give you insight. This weight loss resistance and weight maintenance is much more complex than just calories in, calories out, or a shot of semaglutide or tirzepatide. We also know there's an obesity phenotype. Some people are genetically more prone to being overweight. That's called epigenetics. We inherit from our parents, our family, and that puts us at a greater loss for weight loss resistance. And then there's the influence of things in the gut called short chain fatty acids, resistant starch, things like that. They're all very important. Most people are not eating nearly enough fiber in their diet. We want to strive for 25 to 30 grams of fiber daily. Fiber helps us feel full, satiated, along with protein. It also slows the carbohydrates from banging our insulin bell that I've talked about. Again, I like to use Genova's GI comprehensive stool test to look at gut health. And there's toxins. Unfortunately or fortunately, when you know better, you have to do better. I do tell my patients, do not go throw all your makeup away or your cleaning products away. Just replace things one by one, slowly but surely. There are over 1,300 substances banned or at best heavily regulated and restricted from use in the cosmetic arena in Europe. By comparison, our FDA in the United States of America, we have banned 11. I did not leave out any zeros. The United States has banned only 11 of the hundreds of toxic ingredients that have been scientifically proven to be harmful to your health, because exposure to toxins creates inflammation and oxidative stress. And we've already talked about oxidative stress on muscle atrophy, as well as impacting insulin resistance. So endocrine mimicking chemicals, EMCs, or endocrine disrupting chemicals, EDCs, they actually sit on the receptor site where estrogens are supposed to be sitting. They can bump off our hormones that are supposed to be sitting on those receptor sites. Again, it's all about inflammation and oxidative stress. Gut dysbiosis is a fancy way of saying we've got weeds in our microbiome, our gut's garden. Then compelling research on adverse childhood events. Anyone who has gone through a lot of physical or emotional trauma as a child, you need to look into this. Our heart goes out to these folks. There is emerging research that demonstrates that people have undergone a lot of stressful events as a child. You are more at risk for autoimmune conditions. You're also more likely to be weight loss resistant. So I have to establish that level of trust with a patient for them to open up to me with their personal story, because it definitely all plays a part. So here we go. Hot topic of the day, weight loss prescriptions. Human nature, myself included, we like to find the way to take the easiest path. We have learned that weight loss is much more complicated than calories in and calories out. And with the rise of weight loss medications like those listed here, it's tempting to make a provider's appointment, grab a script, call it a day. Many of us have spent years working toward our weight goal with little to nothing to show for it. I would not be doing my job if I did not encourage you to go a different direction. I have ladies that I actually end up writing a script of one of these for them, but it is not until we have exhausted and we have fixed all those things that we have already ran through. I am not anti-medication. Again, I write these scripts, I write testosterone scripts, but I do have to ask, have we truly considered what is the best option for our health? Do we really just need to slap a Band-Aid on everything without addressing all the other things? And that answer is no. I wouldn't be doing justice to my patients. So semaglutide, as you can see from this slide, it's a GLP-1 receptor agonist, and tirzepatide is a GLP and a GIP receptor agonist. These are primarily used to treat type 2 diabetes, not really anymore. They have also been approved for weight loss, and that's what we see they used often. They have an effect on appetite regulation, satiety, metabolism. Specific dosage and frequency of these meds vary slightly, but each one of them is administered through a self-injection to your arm, your abdomen, your upper thigh. Both GIP and GLP-1 are thought to be involved in memory formation as well as the control of appetite. So Ozempic and Wegovy are the two brand names that Novo Nordisk used to market injectable semaglutide. Ozempic was approved in 2017 as an add-on medication for type 2 diabetes, and Wegovy was approved in 2021 as an add-on to caloric restriction and physical activity for actual weight loss. Ozempic has not been directly compared with Wegovy for helping with weight loss, but if you review the studies, Wegovy may lead to more weight loss than Ozempic does. I think this is kind of silly and a no-brainer. They're the same thing. Wegovy shows more weight loss because its maintenance dose is 2.4 milligrams and Ozempic's dose maintenance is 1 milligram. So of course, we're going to lose more weight when we're on Wegovy. As an aside, if and when in the rare instances I do use these medications, I use semaglutide at 0.25, semaglutide at 0.5 with counseling, with structuring our macros, with getting our hormones aligned, with incorporating the correct movement, mitigating stress. We're not going to need these medicines for long, and we're not going to need them except at the very lowest dose. Most of the time, not at all. In November of 2023, a few months ago, Zepbound, the brand name for Eli Lilly's tirzepatide for weight loss, was approved by the FDA. Again, Wegovy and Zepbound are approved by the FDA for chronic weight management, while Mounjaro and Ozempic are both approved for glucose sugar control in patients with type 2 diabetes. So GIP and GLP-1 are both natural incretin hormones. Those letters stand for gastric inhibitory polypeptide and glucagon-like peptide 1. They're secreted from our intestines when we ingest glucose or nutrients, as they stimulate insulin secretion from our pancreatic B cells. They lower fasting as well as postprandial after meal glucose. They help our pancreas function more efficiently. They decrease our food intake. They reduce our body weight in patients with and without type 2 diabetes. Both of these two products are manufactured by Eli Lilly. So again, semaglutide binds to GLP-1 only, and it stimulates insulin release from the pancreas when it is needed. It helps with weight loss by slowing down how fast food travels through your digestive tract. So we call that gastric emptying. And this may help you feel fuller for a longer period of time and reduce, obviously, how much food that you consume. Again, both of these products are semaglutide. Then again, tirzepatide is a dual-acting GIP and GLP-1 receptor. Lowers pre- and postprandial after-meal glucose. It decreases food intake. It reduces body weight in patients with type 2 diabetes. And again, it's made by Eli Lilly. How do these guys work? Number one, they regulate appetite because they target appetite receptors. The dual products, Mounjaro and Zepbound, they target 2 appetite receptors rather than just 1, like semaglutide does. That's why we see patients losing more weight on them. The second way these work is they slow gastric emptying and the rate at which food moves through our intestines. This delay in gastric emptying, it helps us feel full, and it reduces the overall amount of food that we intake. So they do control caloric intake, and they do change your metabolism. So these meds do have metabolic effects that influence your body's use of glucose and fat. And by reducing the production of glucose by your liver and enhancing your own sensitivity to insulin, you're going to experience likely improved glycemic or glucose sugar control, and then subsequently weight loss. So how much weight loss? 15% of Wegovy patients with or without type 2 diabetes have lost weight with semaglutide. Again, 15% with Wegovy and about 6 to 7% with Ozempic. Why is that? They're both semaglutide. They're the same thing, but Wegovy's maintenance dose is 2.4 and Ozempic is 1 milligram. So 2.4 milligram, it's more than twice as much compared to Ozempic 1 milligram. So I kind of think that's a silly comparison. We do have studies, children ages, this is sad in our society, children's age 12 or we have seen a 16.1% decrease in their body mass index when they were on Wegovy. In studies for patients using Zepbound, tirzepatide, we've seen a 21% weight loss, which is up to 52 pounds using the highest dose, 15 milligrams. That was in patients without type 2 diabetes. Zepbound, again, was approved by the FDA for weight loss in November of 2023. So not a surprise, you're going to see on tirzepatide a greater percent of body mass index lost. It is hitting both of these receptor agonists rather than just one. So again, your Mounjaro and your Zepbound are by far more powerful in regards to blood sugar as well as weight loss. So concerns, do not use these products if you or your family have a history of MTC, you have an endocrine system condition called multiple endocrine neoplasia. Of course, there's gastrointestinal side effects like nausea, diarrhea, constipation, decreased appetite, gas, dyspepsia, indigestion, abdominal pain. If you are having surgery, You need to let your surgeon know so they can instruct you, because anesthesia is going to want you off of these medications at the very least 1 week prior to your surgical date. Slow titration of the dosage up does help mitigate some of the GI side effects. But again, maybe you don't need to titrate the dose up anyway. Maybe you need to go back and look at all those root causes of inflammation and hormonal imbalance, and I bet you may not even have to use these meds at all. Other side effects, of course, injection site reactions, rash, allergic reactions, hair loss. I'm kind of skeptical on the hair loss. Anytime that we lose a significant amount of weight and no one is counseling us on how to remain nutritionally sound or nutritionally solid, you are going to get hair loss. We see it with gastric bypass patients. Why would we not see it with these medications? Why won't these meds work long term? Well, they're not gonna if you don't fix all these things. They only act as a Band-Aid. So instead of addressing root cause behind why you're not able to lose weight, they are going to suppress your hunger cues. They're going to lessen your caloric intake, but they're not necessarily fixing your hormones. They're not keeping you from snacking. They're not helping you sleep better. Yes, I have written these prescriptions for a very few number of my patients after we addressed all of these things. So just know you have got to address chronic inflammation, hormonal imbalance, metabolic disease, metabolic problems, gut dysfunction. Is there an underlying infection? If I don't address all these things and I just give somebody a shot, of course they're going to regain their weight. And that is the statistic that we see out there right now. When people are using these weight loss medications, we see an 85% chance of weight regain. So remember, weight loss is hormonal. It is not calories in, calories out. And again, the injectable medications, they really address calories in, calories out. They lessen the calories that we're taking in, but they really don't fix anything else. They do help our pancreas function more efficiently. They do help us get in tune with hunger cues, which is why I use them in my practice. It's a rare event, but yes, I have written that prescription before because it has helped a select number of patients recognize their hunger cues. It also helped them tamp down their alcohol intake. That is not a condition that it is approved for, but these medications do act upon the dopamine site in our brain. That's our pleasure center of the brain, our pleasure center neurotransmitter. So you do get some effects, some positive effects with just not thinking about food and alcohol quite as much. So when you look at the serious side effects of these medications, combined with the fact that you really don't know so much about long-term effects, although I will say that Byetta, which was a daily shot, similar to semaglutide, I prescribed that back in 2005 when it first came out for diabetes. So we do have some long-term data on the GLP-1s for sure. Not necessarily the combo GIP and GLP-1s. So I just don't want you to waste your money on something less than a comprehensive program because you definitely deserve better. So solutions, yes, I work with patients one-on-one. I have a couple of self-guided programs. For example, we just did a talk on this gut health reset last week and the importance of detoxifying in order to get off of weight loss plateaus. You have to be nutritionally sound. You don't lose weight to become healthy. You have to become healthy in order for your body to free up, release, and lose weight. Part of that is a targeted nutritional supplementation program. So you really want to take a critical look at your foundational health. We women deserve better. We deserve a voice. We deserve a choice and not a one-size-fits-all solution. Like, here's your birth control pill. Here's your hysterectomy, or why don't we do an endometrial ablation? We need somebody to sit down, listen to us, and talk and hear our concerns, our fears, our challenges. We know we're in need of a new paradigm for women's health because of the skyrocketing of those chronic conditions we talked about: Alzheimer's, cardiovascular disease, hypertension, stroke, autoimmunity. Yet women are still being given this one size fits all. Pretty tired of feeling unheard, out of answers, and feeling sick. So your inability to lose weight directly ties to the amount of disease and disease states that I just listed. Please let me help you help yourself. Let me help you find a functional medicine provider in your area. Get you started on the path to sustained weight loss and feeling better. I really appreciate your time this evening and have a good night. Bye now.